9 early signs of Parkinson's disease. 10 years, that's how long some of the very first signs of Parkinson's disease can quietly appear before anyone ever notices a shaking hand. Most people believe this disease begins with a tremor. For a large number of patients, that belief turns out to be wrong. The very first changes often show up somewhere no one thinks to look: in sleep, in smell, in handwriting, long before movement is ever affected. And here's what makes this worth staying for. One of the 9 signs we're about to walk through is a sign neurologists often describe as among the most telling of all, and it rarely gets connected to Parkinson's until much later, mostly because it doesn't look medical in any obvious way. A family member usually notices it before the person experiencing it ever does. So stay with us, because by the end of this video you'll know exactly what to watch for and why timing matters so much. This video is intended for general educational purposes only, and it is not meant to diagnose any condition or replace the advice of a qualified healthcare professional. If anything here sounds familiar, the right next step is always a conversation with a doctor who can properly evaluate your individual situation. Parkinson's disease develops when certain nerve cells in the brain, specifically those responsible for producing a chemical messenger called dopamine, begin to break down and die off gradually over time. Dopamine plays a central role in coordinating smooth, controlled movement, but it also influences mood, sleep, digestion, and even the sense of smell. That's precisely why the earliest signs of Parkinson's can show up in parts of the body that seem completely unrelated to movement. Researchers now believe that by the time classic motor symptoms appear, a significant portion of these dopamine-producing cells may have already been affected. This is part of why understanding the subtler, earlier indicators has become such an important area of medical attention in recent years. There's a term some neurologists use for this earlier period, calling it the prodromal phase, which simply means the stretch of time before a condition becomes fully recognizable through its more obvious symptoms. During this phase, the brain is already undergoing change, but the outward signs remain easy to miss or explain away. What makes Parkinson's disease particularly interesting from a medical research standpoint is just how many different systems in the body can be quietly affected during this window, long before anyone would think to connect the dots. It's a bit like noticing a few isolated puzzle pieces scattered on a table without yet realizing they belong to the same picture. It's also worth saying clearly that having one, or even a few, of the signs we're about to cover does not mean a person has Parkinson's disease. Many of these changes are common in the general population and often stem from entirely different, far less serious causes. Age, medication side effects, other health conditions, and simple daily stress can all produce symptoms that look similar on the surface. The value in understanding these signs isn't to create worry, but to build awareness so that if a genuine pattern does emerge over time, it gets noticed and addressed sooner rather than later. Early recognition tends to open the door to more treatment options and a better overall quality of life, which is really the whole point of a video like this one. Let's walk through 9 of these signs together, starting with some of the least expected and moving toward the ones most people already associate with the condition. Number 1, loss of sense of smell. Long before any tremor appears, many people quietly lose part of their ability to smell everyday scents. This is known in medical terms as hyposmia, which simply means a reduced sense of smell, and it's one of the earliest changes researchers have linked to Parkinson's disease, sometimes appearing 4 to 10 years before any movement-related symptoms surface. It isn't a dramatic loss, either. Someone might not notice that their morning coffee has less aroma than it used to, or that a scented candle in the room barely registers anymore. Consider Margaret, a 71-year-old retired schoolteacher who loved gardening. One spring, she mentioned to her daughter that the lilac she had planted years ago just didn't smell the way they used to. She assumed it was allergies or maybe just getting older. It wasn't until years later, after other symptoms appeared, that her neurologist asked about her sense of smell, and that small detail from years earlier suddenly took on new meaning. What scientists believe is happening here relates to a structure deep in the brain called the olfactory bulb, which processes smell signals before they're interpreted elsewhere. This structure appears to be among the earliest areas affected by the changes associated with Parkinson's disease, which may explain why this particular sign shows up so far in advance of everything else. Some researchers have even explored simple smell tests as a potential early screening tool, asking people to identify a series of common scents like coffee, banana, or cinnamon, since a reduced ability to distinguish between them can sometimes be an early indicator worth investigating further. Reduced smell on its own is common and has many possible causes, including sinus issues, allergies, smoking history, or normal aging, so it isn't something to panic over. But if it appears alongside other changes we'll cover in this video, it may be worth mentioning to a healthcare provider. Number 2, acting out dreams during sleep. Normally, the body enters a kind of natural paralysis during the dream stage of sleep, known as rapid eye movement sleep, or REM sleep. This built-in mechanism keeps us from physically acting out whatever is happening in our dreams. In a condition called REM sleep behavior disorder, that protective paralysis doesn't fully engage, and a person may end up kicking, punching, shouting, or even leaping out of bed while still deeply asleep and dreaming. This is considered one of the more specific early warning signs connected to Parkinson's disease, and research has shown that a notable percentage of people diagnosed with this sleep disorder go on to develop Parkinson's or a related condition years later. Take the story of Robert, a 68-year-old retired mechanic whose wife began sleeping in the guest room after he accidentally struck her while dreaming about fixing a car engine. He had no memory of it the next morning. For years, they both dismissed it as unusually vivid dreaming. It wasn't until a sleep specialist connected the dots that they learned this pattern could be an early neurological signal. What sets this apart from an ordinary bad dream or occasional sleep talking is the physical intensity and consistency of the behavior. Someone experiencing REM sleep behavior disorder might act out entire scenes from a dream, complete with running motions, defensive gestures, or vocalizations, sometimes several nights a week over a period of months or years. Sleep specialists sometimes recommend an overnight sleep study, called a polysomnogram, to observe brain activity and muscle movement during REM sleep, which can help confirm whether this pattern is present. If you or a partner have noticed physical movement, talking, or shouting during sleep that seems disconnected from a normal dream, or if you've woken up finding evidence of movement you don't remember, like a fallen lamp or a bruise you can't explain, it's a reasonable thing to bring up at a medical appointment, ideally with a doctor who specializes in either sleep medicine or neurology. Number 3, constipation that develops without a clear cause. The digestive system relies heavily on the same nerve pathways affected in Parkinson's disease, which is why chronic constipation is now recognized as one of the earliest and most common non-movement symptoms. This isn't the occasional constipation that comes and goes with diet or travel. It tends to be a persistent, ongoing change in bowel habits that shows up years before any other noticeable symptom, sometimes described by researchers as appearing a decade or more in advance. What makes this sign tricky is how easily it gets attributed to diet, hydration, or simply getting older. Many people quietly manage it on their own for years without mentioning it to a doctor at all, assuming it's just a normal part of aging. Part of the explanation involves the enteric nervous system, sometimes nicknamed the body's second brain, which is a dense network of nerves lining the digestive tract that helps control movement through the intestines. This same system appears to be affected early on in Parkinson's disease, sometimes even before changes become detectable in the brain itself, which is one reason researchers have taken a growing interest in digestive symptoms as a possible early clue. A man named Walter, a retired firefighter in his early 70s, mentioned to his physician almost as an afterthought during a routine physical that he had been dealing with sluggish digestion for nearly 8 years. He hadn't thought much of it, chalking it up to a less active lifestyle after retirement. It was only after he began noticing a subtle tremor in his right hand that his doctor asked more detailed questions and realized the two symptoms might be connected. On its own, constipation is extremely common and usually has nothing to do with Parkinson's disease. But when it appears together with some of the other signs on this list, particularly the loss of smell or sleep changes we just discussed, it becomes part of a broader pattern that a healthcare provider may want to explore further. Number 4, smaller cramped handwriting. Here's a change that often gets noticed by other people before the person experiencing it even realizes anything is different. It's called micrographia, and it refers to handwriting that gradually becomes smaller, more cramped, and harder to read, especially as a person continues writing across a page. Words that start out at a normal size may shrink noticeably by the time they reach the bottom of a page or the end of a sentence. This happens because Parkinson's disease affects the fine motor control needed for the small, precise movements of writing. A retired accountant named Harold began noticing this in his own checkbook entries. His wife, Dorothy, pointed out that his signature, once a bold, looping scrawl he'd used for 40 years, had shrunk into something barely legible. He brushed it off as tired hands after a long day. Looking back at old grocery lists and birthday cards can sometimes reveal this gradual shift happening over months or even years, since handwriting samples tend to naturally accumulate in daily life without anyone thinking of them as a health record. Occupational therapists sometimes use handwriting samples as one small piece of a larger assessment, asking a patient to write the same sentence repeatedly to see whether letters shrink progressively as the hand continues moving across the page, a pattern that's somewhat distinct from ordinary, messy handwriting or the natural changes that come with age. It's also worth mentioning that micrographia can sometimes improve temporarily with conscious effort, meaning a person might be able to write normally for a few words if they concentrate hard on it, only for the letters to shrink again once that focused attention fades. If handwriting has become noticeably smaller or more difficult to control compared to how it looked in the past, it may be worth discussing with a doctor, particularly alongside any other signs mentioned here. Number 5, a slight tremor at rest. This is the symptom most people already associate with Parkinson's disease, and for good reason, since it's one of the most recognizable motor symptoms. It typically starts subtly, often in just one hand or finger, and tends to appear when the limb is relaxed and at rest rather than during active movement. Some describe it as a rhythmic shaking motion, sometimes compared to rolling a small object between the thumb and forefinger, which doctors sometimes refer to as a pill-rolling tremor because of that particular visual similarity. What surprises many people is how selective this tremor can be in its early stages. It might show up only when sitting quietly watching television, and then disappear the moment the hand is used to pick up a cup or turn a page. This distinction matters quite a bit medically, since a tremor that occurs at rest behaves differently from one that appears during intentional movement or while holding a position, and doctors often pay close attention to exactly when a tremor shows up as part of forming a clearer picture. A woman named Susan first noticed hers while waiting in a doctor's office for an unrelated appointment. She glanced down and saw her hand trembling slightly in her lap, something that stopped as soon as she reached for her purse. She almost didn't mention it during her appointment that day, assuming it was just nerves, but her doctor asked a few follow-up questions that led to further evaluation down the road. It's worth noting that tremors can have many causes that have nothing to do with Parkinson's disease, including essential tremor, certain medications, thyroid conditions, or too much caffeine, so this particular sign should never be interpreted on its own. A healthcare professional can help distinguish between these different possibilities through a proper neurological evaluation. Number 6, slower, more effortful movement. Medically referred to as bradykinesia, this sign involves a general slowing down of voluntary movement that can affect nearly any activity, from buttoning a shirt to walking across a room. It's different from simply feeling tired or being less active. Instead, movements that were once automatic start requiring conscious effort and take noticeably longer to complete. Family members often describe it before the person themselves recognizes it. A son might notice his father takes considerably longer to get out of a chair than he used to, or that his mother's steps have become smaller and more deliberate when walking to the mailbox. There's a story of a man named Frank, a retired postal worker, whose daughter first suspected something when she watched him struggle for nearly a full minute trying to unlock his front door with a key he'd used every day for 20 years. He described it simply as his hands not moving the way his brain told them to. This slowing tends to be especially noticeable with repetitive movements. A doctor might ask a patient to tap their thumb and index finger together as quickly as possible, watching not just for slowness, but for a pattern where the movements start off reasonably quick and then progressively shrink in size and speed the longer the motion continues. This particular pattern, sometimes called decrement, can offer useful clues during a clinical examination. Everyday tasks that rely on rapid, repeated motion, like brushing teeth, typing, or fastening buttons, are often where bradykinesia becomes most apparent to the person experiencing it. Because slower movement can also result from arthritis, general fatigue, depression, or other medical conditions entirely unrelated to Parkinson's, this sign is most meaningful when it appears alongside several of the others we've discussed. Number 7. Reduced facial expression. This sign is sometimes called facial masking, and it refers to a noticeable reduction in the spontaneous facial movements most of us make without ever thinking about it, like smiling in response to a joke or furrowing the brow when concentrating. The muscles of the face are affected by the same processes involved in other Parkinson's symptoms, which can result in an expression that appears flatter, more serious, or less animated than what feels natural for that person. This particular sign can be especially difficult emotionally, both for the person experiencing it and for the people around them, since facial expression plays such a large role in how we connect with others. Friends or coworkers might mistakenly interpret it as disinterest, sadness, or aloofness, when in reality, the person may be feeling perfectly engaged on the inside, sometimes leading to painful misunderstandings in relationships or workplaces where facial cues are taken as a reflection of genuine emotion. A woman named Patricia recalled that her closest friend gently asked her, more than once, whether everything was all right, simply because her face wasn't lighting up the way it used to during their weekly lunches. Patricia herself hadn't noticed any change at all, since the shift in her own expressions wasn't something she could see happening from the inside. It took a doctor's visit, prompted by that same friend's concern, to connect this change to a broader pattern. This disconnect between how someone feels internally and how their face reflects it outwardly is part of what makes facial masking such a uniquely challenging symptom, both to notice and to talk about. Reduced blinking frequency sometimes accompanies this sign as well, contributing further to what can look like an unusually fixed or serious gaze. Number 8. A softer or more monotone voice. Changes in speech, known medically as hypophonia, often develop so gradually that neither the person speaking nor those around them notice right away. The voice may become quieter overall, lose some of its natural pitch variation, or start to sound slightly breathy or hoarse. Conversations that once felt effortless might now require the speaker to repeat themselves because others keep asking them to speak up. This can be particularly noticeable to people who haven't seen someone in a while. A grandson visiting for the holidays might comment that his grandfather's voice sounds different on the phone lately, softer, flatter, harder to hear across the dinner table. Often, the person experiencing this change genuinely believes they're speaking at their usual volume, since the shift happens slowly enough that it becomes their new normal without them realizing it, and the brain naturally compensates by perceiving the reduced volume as adequate. Speech-language pathologists sometimes work with patients on techniques designed to increase vocal loudness and clarity through structured practice. And some have found that consciously over-exaggerating volume, to the point where it feels almost too loud to the speaker, actually brings the voice back to a level that sounds completely normal to everyone else in the room. This mismatch between internal perception and external reality is a recurring theme across several of the signs we've discussed today. If loved ones have mentioned needing you to repeat yourself more often, or if you've noticed your own voice sounding different on recordings or video calls, it may be a helpful detail to bring up during a medical checkup. Number 9. Changes in posture and walking pattern. The ninth sign brings together several smaller changes into one noticeable pattern. Posture may begin to stoop slightly forward at the shoulders. Arms swing while walking may become reduced or uneven on one side compared to the other, and steps themselves may grow shorter, sometimes described as a shuffling quality to the walk. Turning around, particularly in a tight space, might also start to require several smaller steps instead of one smooth pivot. These changes tend to develop so gradually that clothing that once fit well might start to feel differently proportioned, simply because posture has shifted. A retired dance instructor named a leaner, who had spent decades standing perfectly upright in front of classrooms, was the one who noticed this in herself before anyone else did, catching her reflection in a store window and thinking, for just a moment, that she didn't recognize the way she was standing. Physical therapists sometimes look closely at what's called arm swing asymmetry, meaning one arm moves noticeably less than the other while walking, which can be one of the more subtle early clues within this broader category of change. Some people also describe a tendency to freeze briefly while walking, particularly when approaching a doorway or navigating a crowded space, feeling as though their feet have momentarily become stuck to the floor before movement resumes. Because posture and gait can be influenced by many factors, including hip or spine conditions, inner ear problems, or simple muscle weakness. This sign is best understood as one piece of a larger picture, rather than something to interpret in isolation. Taken individually, none of these 9 signs guarantee anything on their own. Many of them are common, ordinary, and often explained by something else entirely, whether that's aging, another medical condition, or simply life circumstances. What matters most to neurologists is the pattern, the way several of these changes might appear together over a period of months or years. Research suggests that non-movement symptoms like the loss of smell, sleep changes, and constipation can precede the more recognizable motor symptoms by 10 years or more in some cases, which is exactly why early awareness matters so much. The earlier a pattern like this is recognized and discussed with a healthcare provider, the sooner someone can access support, monitoring, and care tailored to their specific situation. It's also worth remembering that Parkinson's disease affects each person somewhat differently. 2 people with the same diagnosis might experience entirely different combinations of these signs, in a different order, and at a different pace. That's part of why self-diagnosis based on a video, even one as thorough as this, is never a substitute for a proper medical evaluation. A neurologist has access to detailed examinations, imaging, and other tools that can help build a much clearer and more accurate picture than any single symptom checklist ever could. If anything you heard today reminded you of yourself or someone close to you, the most valuable thing you can do isn't to jump to conclusions, but to have an honest, unhurried conversation with a doctor who can look at the complete picture. Keeping a simple written record of when certain changes started and how they've progressed can actually be tremendously helpful heading into that kind of appointment, giving a physician real information to work with rather than vague impressions. We'd genuinely like to know, which of these 9 signs surprised you the most, the one you never would have connected to Parkinson's disease before watching this? Let us know in the comments below, and if you found this information valuable, sharing it with someone who might need to hear it could make a real difference in their life. If you'd like more videos like this one, breaking down complex health topics in a way that actually makes sense, consider subscribing so you don't miss what we cover next.